Glucophage, also known as Metformin, is a new medication to control blood sugar levels in patients with type 2 or non-insulin dependent diabetes. There are currently 3 classes of medicines to lower blood sugar. One class of medications, called the sulfonylureas, lower blood sugar by stimulating the pancreas to make extra insulin. By increasing insulin levels, blood sugar levels are lowered. The second class of medications to help control sugar levels are the starch blockers, which delay the absorption of carbohydrates from the intestine. The third type of medication is metformin or glucophage, which lowers blood sugar by improving the efficiency of the body's insulin. Glucophage improves the efficiency of insulin by 25% on average. As a result, insulin levels in patients who take glucophage are significantly lower than in patients who take one of the sulfonylureas. Advantage of glucophage over sulfonylureas. The major advantage of glucophage is that it does not cause low blood sugar, since it does not interfere with the body's natural sugar regulation system. Diabetics who are treated with diet alone rarely develop low blood sugar. On the average, however, roughly 30% of patients who take insulin shots, and in a smaller but significant portion of patients who take sulfonylureas, experience episodes of low blood sugar. It is unusual for patients who take glucophage to experience low blood sugar unless it is combined with one of the sulfonylureas. Effect of glucophage on glucose control. Glucophage is very effective in lowering blood sugar levels. This is a typical response to glucophage when fasting blood sugar levels are followed over a 30-week period of time. Glucophage lowered the average fasting blood sugar by 59 points compared with a placebo. The average improvement in hemoglobin A1C was 1.8 points. This amount of improvement in blood sugar control is very significant, since in the diabetes control and complication trial, reductions of this amount were associated with a 76% reduction in risk of eye damage, a 60% reduction in risk of developing nerve damage producing chronic leg pain, and in many instances amputation, and a 2-fold reduction in risk of developing bad kidneys. Combination of glucophage and sulfonylureas. Glucophage can also be given with glyburide and other sugar-lowering medications to produce further improvements in sugar control. This is the additional benefit when glucophage is added to glyburide in a study involving over 400 patients. The addition of glucophage to glyburide further reduced the hemoglobin A1C by an additional 1.7 points. Effect of glucophage on weight and serum lipids. Since glucophage does not increase blood insulin levels, it does not increase appetite, which usually results in weight gain. In studies to date, when patients were switched over from glyburide, also known as diabeta, or glipizide, also known as glucotrol, to glucophage, the average weight loss was almost 9 pounds. In addition, glucophage will improve blood lipid levels. On average, glucophage will lower the average cholesterol by 5%, LDL cholesterol by 8%, and triglyceride levels by 16%. The average HDL level will increase 2%. We know from many previous studies that for every 1% reduction in LDL cholesterol, there is a 2% reduction in risk of having a heart attack. In addition, for every 1% increase in HDL levels, there is a 3.5% reduction in risk of having a heart attack. For these reasons, we expect that therapy with glucophage will also lower the risk of having a heart attack. Changes in cholesterol values of this size can be expected to lower the risk of having a heart attack by roughly 25%. Side effects. Glucophage does have some side effects. The most common side effects are diarrhea, nausea, and loss of appetite. These occur to some extent in 30% of patients, but are usually mild. Only 1 person in 50 is bothered by these symptoms enough to stop taking the medication. If Glucophage is taken with a meal, the side effects are usually minimal. Within 1 or 2 weeks, the diarrhea is usually gone. The only serious side effect is lactic acidosis, a condition in which the body makes too much acid. This problem is very uncommon. By taking the usual precautions, which will be covered shortly, the risk of this rare but serious complication is less than 3 in 100,000 patients per year. The symptoms of lactic acidosis are hyperventilation and constant shortness of breath. Glucophage is eliminated from the body in the urine. Therefore, anything that interferes with kidney function can increase the risk of developing the rare complication of lactic acidosis. Therefore, people who have bad kidneys or with a serum creatinine of 1.5 or greater should not take Glucophage. In addition, if a person is going to take an X-ray test using dye, the Glucophage should be stopped 2 days before the dye test and 2 days after to prevent the risk of lactic acidosis. Glucophage should be avoided in patients who have bad livers, known alcoholics, or binge drinkers. Glucophage should be temporarily stopped by people who develop acute congestive heart failure, acute heart attacks, patients who undergo acute surgery, or who get acutely sick for any reason and are unable to eat food. How Glucophage is started. The starting dose of Glucophage is a 500 milligram pill twice a day with the 2 largest meals of the day. Within 1 week, if the fasting sugar is higher than 125, the dose can be increased to 2 500 milligram pills with the largest meal and 1 500 milligram pill with the other meal. Within 1 week, if the glucose is not lowered enough, Glucophage can be increased to 2 500 milligram pills with the largest meals. The peak dose of Glucophage is 5 500 milligram pills per day with meals. If diarrhea develops from Glucophage, reduce the dose by 1 500 milligram pill and wait 2 weeks before advancing the dose. The diarrhea usually goes away by itself. In a person who is not performing routine testing of blood sugar levels, slower increases in the amount of Glucophage taken is necessary. Use of Glucophage in the elderly. Elderly patients frequently have reduced kidney function even though they have relatively normal kidney test numbers. For this reason, Glucophage should be used in lower doses in elderly patients and usually not above 3 500 milligram pills per day. Monitoring. Initially, the blood sugar response to Glucophage should be monitored by testing with the finger stick. When the fasting blood glucoses are below 125 points, additional monitoring should be performed by measuring the hemoglobin A1C, usually at 2-month intervals, until it is less than 7.0. Summary. Glucophage is an exciting new medication to treat type 2 or non-insulin dependent diabetes. It works by increasing the efficiency of the insulin that the body already makes. When used by itself, it has the major advantage of not causing low blood sugar levels. It also improves cholesterol numbers, which would be expected to reduce the risk of having a heart attack and stroke. Unlike the other diabetic medications, it does not cause weight gain, and in studies to date, Glucophage has shown to reduce weight by almost 9 pounds when used instead of other diabetes medications. Glucophage can be used with other diabetic medications to produce further reductions in blood sugar levels. Glucophage should be started in low doses with meals and increased gradually under careful monitoring. We now have some questions and answers for you on this important information. How many types of pills are available to lower blood sugar levels? A, 1, B, 2, C, 3, D, 4, E, 5. Answer C. There are 3 types of medications to control sugar: sulfonylureas, which lower blood sugar by stimulating the pancreas to make extra insulin; starch blockers, which delay the absorption of carbohydrates from the intestine; and metformin or glucophage, which increases the efficiency of the body's own insulin. What are the advantages of metformin or glucophage compared with sulfonylureas? Glucophage lowers insulin levels. Glucophage does not cause blood sugar levels to fall to dangerously low levels. Glucophage leads to weight loss in many diabetics. Glucophage improves cholesterol values. All of the above. Answer E, all of the above. Glucophage lowers insulin levels, does not cause the blood sugar to fall to dangerously low levels, frequently leads to weight loss by reducing appetite, and improves cholesterol levels. Has metformin or glucophage been shown to lower average blood sugar levels? Yes or no? Answer, yes. Glucophage has been shown to lower fasting blood sugar levels by almost 60 points and hemoglobin A1C by almost 2 points. Reductions of blood sugar levels of this amount can be expected to reduce the risk of eye damage by 76%, painful nerves in the legs by 60%, and a 2-fold reduction in the risk of getting bad kidneys. What are the common side effects of metformin or glucophage? Complete loss of hair, diarrhea, loss of appetite, nausea. Answers B, C, and D. Diarrhea, loss of appetite, and nausea are the common side effects. They occur in about 1 person in 3. These usually go away within 2 to 3 weeks and can be reduced by taking the medication immediately before a meal. Only 1 person in 50 is bothered enough by these side effects to stop taking glucophage. How often is the serious side effect of lactic acidosis seen with glucophage? Lactic acidosis only occurs in 3 persons in 100,000 patients per year. Who should not take glucophage? Alcoholics, binge drinkers, people with bad kidneys, people with bad livers, all of the above. Answer E, all of the above. People with bad kidneys, bad livers, and drinking problems should not take glucophage. How should glucophage be started? Take the full dose of 2 500 milligram pills per day immediately and check fasting blood sugars every month. Start with 1 500 milligram pill twice a day and gradually increase the dose at weekly intervals while checking blood sugar levels by the finger stick method. Start with 500 milligrams per day and check fasting blood sugars every other month for 6 months. Start with 1,000 milligrams twice a day and increase to the full dose of 1,000 milligrams 3 times a day after 6 weeks if the sugars are not controlled. Answer B. Start with 500 milligrams twice a day, immediately before meals, and gradually increase the dose at weekly intervals until the fasting blood sugar is less than 120 points, or until a maximum of 500 milligram pills per day is taken. There are special recommendations for Glucophage in the elderly. True or false? Answer: true. The dose of Glucophage should not be increased over 1,500 milligrams per day in elderly patients. I hope this educational video helps you understand the proper use of metformin or Glucophage. With proper use, it will improve your blood sugar control, it will reduce the complications of diabetes, and it will improve the quality of your life.